My name is Susan Perez, and today I'm going to be talking to you about psychiatric facilities. Having a mental illness isn't easy, and it's even harder when people just assume that you could just get over it. My thesis is that the United States should build more psychiatric facilities, especially in the major cities such as California. First, I will talk about why our emergency departments are overcrowded with psychiatric patients and why this is an issue. Secondly, I will talk about how many people are affected by mental illness and why people can't find help due to their income. And lastly, why we need to help these individuals before it's too late. My first argument as to why we need to build more psychiatric facilities is that our emergency department is overcrowded with patients in need of treatment, both medical and psychiatrical. I personally have had the opportunity to witness this firsthand because I work in an emergency department. And according to the article written in 2018, factors associated with prolonged length of stay in the psychiatric emergency service, patients often receive little active treatment in the ED due to limitations of their settings, and often crowded and noisy environment may eventually worsen their conditions. Personally, I have seen many psychiatric patients brought in for treatment, whether it's willingly or forced. They come via ambulance or they're coming with family as walk-ins. We first have to medically clear these patients that come into the emergency department. This entails getting a blood panel, urine, and a tox screen. Once they're medically cleared, we're able to call the evaluator. An evaluator then comes to evaluate the patient. They ask a series of questions. Why are you here? Are you trying to harm yourself or others? Are you hearing voices in your head? Things like that. If the evaluator thinks that they need to be placed on a hold, they're either placed, if you're an adult, a 5150. If you're a minor younger than 18, then it's 5585. This hold is good for 72 hours. Legally, the hospital has the right to keep you for 72 hours until they could find treatment or a other psychiatric facility for your needs. If the 72 hours are up, then the evaluator then gets called once again, and they either place you on another hold or they go ahead and discharge you. With this, a lot of patients are getting discharged that need psychiatric help and are dangerous to self and danger to others. Just because they're not at that moment doesn't mean that they will later on. This becomes very dangerous and it brings up a lot of issues because we can't find treatment for them. We can't find a facility for them. So it's really hard to keep them in the emergency department. What happens is sometimes we have 8 patients and 8 patients that are on a hold. Therefore, those are 8 beds that could be used for a medical patient. If you're coming for shortness of breath or if you're having chest pain, you have to wait a little bit longer because those rooms are reserved for psychiatric patients. If we had the resources to place them right away, then we would be able to bring patients in and bring patients out. This is why it becomes a problem in the emergency department settings because, one, they're not getting the treatment that they need. We are not giving them the medication that they need because sometimes patients lie, sometimes patients don't bring their med list, so therefore it becomes a problem. There's a lot of demand for psychiatric facilities, but not enough supply. So in the article, Experiencing Healthcare Among Homeless Individuals with Mental Health Conditions, published in 2015, it says that people experiencing homelessness are faced with medical, social, and environmental challenges to their physical and mental health. There's a high rate of psychiatric disorders within the homeless accessing primary care, and so they came to a conclusion that it leads to higher mortality rates and it worsens their condition. Now, transitioning to my second point is that mental illness is a huge problem here in California. According to the article, Mental Health in California, Far Too Many Care Not There, published in 2018, mental health disorders are among the most common health conditions faced by Californians. Nearly 1 out of 6 Californians experience mental illness. And their findings concluded that it's a very prevalent on how much you make. So it kind of, they said that their study states that if you come from a lower income, you're more likely to have mental illness. The argument that many say is that there's not enough money to build psychiatric facilities. In the article, Stanford's Psychiatric Deal Falls Through, written in 1990, a committed private industry to support psychiatric research, and a new psychiatric facility abruptly just withdrew their funds. They concluded that they weren't going to be profitable. Therefore, it was a waste of money to build these other resources for these individuals because they didn't see profit, which then later then will affect their economy. However, in the article, How to Make Money Off of the Mentally Ill, written in 2011, they said that they make money because insurance covers 80% of the cost, and there's still 20% that still needs to be covered. That comes out of either the patient's pocket or Medi-Cal or Medicare. It really just depends on their insurance and the person. Psychiatric drugs can cost up to $400 each month, so there is a huge amount of money coming in. There should be enough money to build a facility to make it easier for these individuals to find placement that, or to find the resources that they need in order to get better. Now, transition to my last point, that we must help these individuals struggling with mental health before it's too late. There's an article in the National Alliance of Mental Illness that someone struggling with mental illness wrote to help us better understand what they go through. And they said this: it hits you all of a sudden. It's in the middle of the day, you're surrounded by friends, and the sun is out, but something isn't right. There is a feeling, a very uncomfortable feeling in your mind, in the pit of your stomach. You want to leave and go somewhere that it's quiet and dark. You are being consumed by your own thoughts, so dark and so horrid that you're afraid. It's wrecking you from the inside out. It feels like you're drowning and unable to breathe. You feel numb and flat, but what can you do? Suffer? That's what so many of us do and did, but sometimes the suffering gets too much. You can't handle the darkness that's pulling you into an internal abyss, and you decide that the only way to start the darkness is to join it. You take your own life, suicide. That's the only way to stop the pain. Simple as that. So this really hits home because there's a lot of people struggling with mental illness that don't really understand how to go about it. So even though people are struggling with this, it's still the second leading cause of death for ages 10 to 36. We need to help these patients. We need to help these people find what they need, find the help that they need in order to make everything a little bit better. In conclusion, is that we need change. Is that there's a huge need for psychiatric facilities all over the U.S. However, we see a huge need in the major cities also, like just as California. First, I talked about the high number of psychiatric patients in the emergency department and why it's a problem. Secondly, I spoke to you about how many people are affected by mental illness and why they can't find help due to their income. And lastly, is that we need to help these individuals before it's too late. The call to action is to advocate for legislation that could recognize the importance of peer support. Also encourage greater and more open communication between providers and those who live the experience. We need to help these individuals. We need to help them find treatment, and we need to help them find treatment quickly before it's too late. Thank you guys for watching.